أعوذ بالله الشيطان الرجيم بسم الله الرحمن الرحيم. There was a problem. There was a problem with the internet. The internet is very weak. The internet was very weak. So I think we can now continue. So I was saying today our lesson is about global health economics. And what we shall be basically covering is these are the lesson objectives. That is, by the end of this lesson, you should be in a position to do what? You should be in a position to define health system, distinguish between public and private health funding, explain health insurance model, evaluate healthcare intervention, understand health equity, ila ghairi dhalik. So all these are our lessons objectives. So number one is basically to define what is the meaning of health system financing. So health systems financing refers to the way in which financial resources are collected, allocated, and spent to provide healthcare services. It ensures that the system has enough funding to deliver quality healthcare while maintaining sustainability. So when you're talking about health system financing, we are basically saying that how do we get the money to fund the health sector? How is the budgeting for the health center? And how is the money spent in the health center? So this ensures that the system has enough funding to deliver quality healthcare. So we should always ensure that the healthcare has enough funding. But unfortunately, in many countries in Africa, a lot of budget goes to the defense. But if you go to the high developed countries, as you were saying yesterday, they're investing a lot in what? In health infrastructure. They are investing a lot in training and development. إلى غير ذلك. Now, we have the public and private health funding. What's the meaning of public vis-a-vis the private health funding? So number one, public funding. So this is when governments allocate tax revenues or other public resources to fund healthcare system. So for example, in Somaliland, maybe the government is collecting taxes from people. And the money the government collects, it invests this money in the sector of hospital and health. So it ensures universal access to healthcare services, particularly for vulnerable population. So the money the government collects, it invests this money in health sector, particularly in areas where people don't have access to health facilities. Those are the vulnerable population. So the government also fund health infrastructure. The government can also use the money they collect to build hospitals, to do research, and to promote public health programs and initiatives. So this is what is meant by that is what is meant by public funding. And we are being given an example of United Kingdom. They have what is called the National Health Service, which is primarily publicly funded. Number two, we have the private funding. Private funding involves individuals or private companies funding healthcare services, either through out-of-pocket payments or private insurance scheme. It may lead to unequal access depending on individuals' ability to pay. So here, when you're talking about private funding, it is the opposite of public. In public, the government is the one that does the funding. But here, it is completely the opposite. So it is out of the pocket. You have to pay. If you go to the hospital, you have to pay for the services that you get. Or maybe if you don't pay, then your company, if for example you are working with the Shield company, some of them, they normally cover for the health expenses of their employees. So that can also fall under private funding. Now, number three, we also have what is known as health insurance model. So health insurance helps spread the financial risk of health costs across a population. So when you're talking about health insurance, for example, you can insure yourself with an insurance company. Unfortunately, in most countries in Africa, like in Somalia, I don't know if you have an insurance company. So you can insure yourself in an insurance company. If you get sick, then the insurance company is going to pay for the money, not you. But every month you have to pay the insurance company like $2. Every month you pay $2. And so we normally call this the premium. And in return, if you get sick, the insurance company is going to do what? The insurance company is going to pay the bills. So that is the meaning of health insurance. That is, you are transferring the risk to another company. And there are different models. There are different models based on the sources of funding and how costs are distributed. So, for example, you have the Bismarck model. This is in Germany. So, health insurance is financed by employers and employees through payroll deduction, but the insurance funds are private. So, in this case, for example, you are working at the Habshil Bank, and the Habshil is paying you $300 every month. So what is going to happen is that at the end of every month, the Habshil is going to deduct $5 from your salary. These $5, they're going to give it to the insurance company. So when you are sick, the insurance company, sometimes they give you a card. You can just use the card in any hospital. So every month, you don't get $300, you get $295. Number two, so that is the Bismarck model. Both the employer and employee. We have the beverage model. So in this scale, healthcare is funded by the government through taxes. So this one, the government funds. And most healthcare facilities are provided by government-employed healthcare workers. So the beverage, it is funded 100% by the government through the taxes. So the first one, Bismarck, is like it's private, but beverage is public. Then number three, national health insurance model. So a single government-run insurance system that covers all citizens, with the government providing insurance and funding healthcare. So like in Canada, for example. So here, the government has an insurance company. So the government is the one that insures people, not from the taxes. No, the government is the one that it does not collect taxes to pay. No, it just like it gives free medical services to the people without them being taxed. Then number four, we have the out-of-pocket expenditure. Out-of-pocket expenditure refers to direct payment made by individual for health services, including co-pays, deductibles, and uncovered service. This is common in systems where public coverage is limited or where there is no public coverage at all. So, for example, in India and Mexico, even in most of the countries in Africa, when you go to the hospital, the government does not pay, so you have to pay for the expenses. It's just like in Somaliland, if you go to any hospital, you'll have to pay the money. The government is not paying anything. So this is known as out of pocket. You just have to pay for the lab, the test, the check, ila ghairi dhalik. So these are the four health insurance models. Now, global health funding institution. Remember, we are talking about the international or the global health care. So where do they normally get their money from? This health care, the world, for example, we have the World Health Organization, ila ghairi dhalik. Where do they get their fund? Who funds their activities, their programs, and their training, and their facilities, and their infrastructure? So, global health funding institutions, these are organizations that provide financial resources for health initiatives and systems around the world, especially in low and middle income countries. So the Global Health Funding Institution, these are organizations that supports, gives resources to, and gives money to the low and middle income countries. So number one, we have the World Bank. The World Bank finances health programs. So there are some health programs, maybe malaria programs, you can have the AIDS, the missile programs, infrastructure projects, building of hospitals, building of lab, cancer centers, and initiatives aimed at improving health outcomes globally. That is why it is called World Bank. It also provides loans or grants for healthcare improvements in low-income countries. So sometimes it also gives the low-income countries, it gives them loan, sometimes with interest, sometimes with low interest rates. Example, the World Bank helped finance the HIV program in sub-Saharan Africa, contributing to prevention and treatment efforts across multiple countries. So the first one is the World Bank. Number two, we have the Healthcare Organization. It is a specialized agency of the United Nations. It is under the United Nations, and it coordinates international health activities and provides technical assistance to countries. It works on health policy, funding for disease control, and emergency responses. For example, the World Health Organization, played a key role in Ebola. And Ebola, it was in 2014, 2016 in Congo, in West Africa, providing both financial and technical support. So it really helped to minimize the spread of the Ebola. Then number three, you have the Global Fund. The Global Fund to fight AIDS, TB, and malaria. So they normally focus with these three areas: AIDS, the TB, and malaria. It's a major funding body that pools resources from governments and private donors to support health programs. So the Global Fund, it gets funds from other countries that are very rich. For example, the United States, the UK, Malaysia. So it seeks funds from all these rich countries and organizations, and it uses these funds to do what? To support health programs and addressing diseases in poor countries. Now, the method for evaluating healthcare intervention. How can we evaluate? Because remember, these three organizations or more, they normally use a lot of money in healthcare and health infrastructure. So how can they measure? How can they measure? How can they evaluate the health care or outcomes from this world? The outcomes from all these facilities. How can they do it? So they're telling us methods used in CEA typically compares the cost of an intervention to its health outcomes, often expressed in terms of quality adjusted life years or disability adjusted life years. The most common method used is to calculate the incremental cost effectiveness ratio, which compares the cost of an intervention to the extra benefit it provides. So in a nutshell, for example, a study might evaluate the cost effectiveness of a new drug for treating hypertension by calculating how much money is spent per year of life gain or the quality adjusted life improved. If the cost of the drug is $5,000, for example, and the drug leads to a gain of a quality adjusted life, the ICER, which is the incremental cost effectiveness ratio, is 2,500 per quality gain. So here, just to summarize what they're saying here, is if we want to know or if you want to evaluate the healthcare intervention, what do we normally do? We normally compare the cost of an intervention to the extra benefit. A good example, for example, the WHO, they can build a hospital in Boroma. So how can they evaluate if this hospital in Boroma is successful. How? So it can only measure by comparing the amount it invested in building the hospital and the benefits for the people of Boroma. If the benefits of the hospital is more than the money it invested in the hospital, so it can be said that this project was very successful. But if the money that was invested in the hospital is if for example, if the impact is lower than the money invested, then that intervention is not successful. So we normally compare the impact that people are getting from any health intervention. So number one, we normally have what is known as cost effectiveness analysis. This is the meaning of the CEA. In an exam, you can be asked, what is the meaning of CEA? So CEA means cost effective analysis. So what is cost effective analysis? This is a method used to assess the relative cost and outcome. How much did we use in building this hospital? $5,000. What is the outcome? Is the outcome how many people are benefiting? Is it more than the 5,000? If it is yes, then this project was very successful. So an outcome, which is typically the health outcomes of different intervention. So the goal, this is very important, the goal is to determine which health intervention provide the best outcome for the least amount of money. So the WHO, it wants to know which initiatives provide the best outcomes for the least amount of money. So because at the end of the day, we want value from our money. So we want to use a little money to get more benefit. That is what the cost effectiveness analysis is all about. Now, so this is the cost effectiveness analysis. Then we have the cost benefit analysis. So what is cost benefit analysis? So it is the CBA in global health. The cost benefit analysis differs from the cost effective analysis in that it compares the cost of an intervention to its benefit. This is the example I was telling you before of the cost benefit analysis. It compares, for example, if the WHO, it builds an hospital in Boroma, it will compare the cost of the hospital plus the benefits. If the benefit is more than the cost, then that is a good project. But if the cost is small and the benefit is low, so it means that's not a good intervention. So it does what? It compares the cost of an intervention to its benefit, with benefits being expressed in monetary terms rather than the health outcomes. It aims to determine whether the benefits of a hospital or intervention justify its cost and whether the benefits exceed the cost across different interventions. So the cost benefit analysis normally looks at, are the benefits more than the cost? If the answer is yes, then we continue with that project. But if the cost is small, then that project or intervention is not efficient or it's not effective. Now, what are the thresholds for cost effectiveness? When we are talking about threshold, we are talking about how can we measure? What are the metrics for measuring the cost effectiveness? So thresholds for cost effectiveness refer to what? The cost per unit of health outcome above which an intervention is considered too expensive and below which it is considered a good investment. These thresholds vary depending on the country, the level of resources available, and the severity of the health issue. For example, in high-income countries, a cost effectiveness threshold may be set at 50,000 per QALY gain if an intervention costs. So this is just a lot of issues related to the numbers. But what they're basically telling us, just focus with this definition. When you are talking about the threshold for cost effectiveness, it refers to the cost per unit of health outcome. For example, if we use the same example of the hospital in Boroma, so it basically refers to what is the cost per unit of the impact of the hospital in Boroma. And there is a formula of calculating this, so you cannot really understand this unless we do some calculation, which can be very complex. Now, the next thing is about health equity and access. Remember when there is this course, I don't know, I think we did it, the health impact analysis. I think we did this course in semester 2 or semester 3. No, semester 1 or semester 2. And we covered this topic about health equity and access. We also talked about the social determinants of health, the economic determinants of health. So when you're talking about the global health finance, we also need to talk about health equity and access because it's related to money. If you have money, you can get health services. If you don't have money, you cannot get. So it is the role of these organizations to ensure that countries that are poor, at least they get or they have access to health services. So health equity and access refer to the fair distribution of healthcare services, ensuring that everyone, regardless of their social or economic status, can access quality healthcare. So that's the definition of what? Health equity and access. So that we don't care where you live, we don't care where you come from, we don't care where you work, we don't care if you are poor or rich, but everybody can get good quality service. So addressing health equity is crucial in achieving better health outcomes, particularly in disadvantaged population, particularly in Africa. So what are the economic determinants of health inequity or inequality? What can lead basically to this inequality? Inequality basically means some people can get access to, some people they cannot get access to. So economic determinants of health inequality are what? Are the social and economic factors that influence individuals' access to healthcare and their overall health outcomes. These include income. There are some people who work, they get salary at the end of the month. So if they get sick, they can go to hospital. There are some people who are unemployed, they're jobless. So if they get sick, they cannot go to hospital because they don't have money. Wealth, there are some people who have a lot of wealth. They do business, they have a lot of projects, they have a lot of money. Some people they don't have. Education, there are some people who are educated, so they can easily take good care of themselves. But there are some people, they're juhala, they're very ignorant. Employment and also living condition. There are some people who live in very pathetic conditions. There are some people who live in good areas. So their health and their ability to access health cannot be the same. So all these factors often lead to disparities in health between different socioeconomic groups. So all these factors, it normally leads to inequality in health access. For example, income inequality can lead to unequal access to healthcare services. For instance, individuals in low-income households may not afford private healthcare services, medications, or health insurance. In the United States, people living in poverty often have higher rates of chronic diseases, such as diabetes, due to limited access to what? To preventive healthcare. Another example, education is another economic determinant. Studies show that people with higher level of education tend to live longer and have better health outcomes. This is partly because they are more likely to engage in healthier lifestyle and have better access to healthcare services. Now, access to healthcare in low-income countries. When you are talking about low-income countries, like we said yesterday, the low-income countries, most of them are in Africa, and some of them are in South America, and some of them are also in Asia. So access to healthcare in low-income countries is often limited by several factors. So people in Africa, most of the countries, they cannot get good quality healthcare. Why? Including lack of financial resources, people don't have enough cash money, insufficient healthcare infrastructure, there are not enough hospitals, enough lab, and a shortage of trained healthcare workers. In Africa, we don't have enough medical practitioners. So many people in these countries face significant barriers to obtaining necessary healthcare, leading to poor health outcomes. So, for example, in sub-Saharan Africa, access to healthcare is limited due to inadequate healthcare facilities, insufficient healthcare workers, and high out-of-pocket costs. If you go to the hospital, it costs a lot. For example, many rural communities cannot access hospital or clinics. An individual with serious health issues may have to travel long distance to receive treatment. Another example, during the COVID-19 pandemic, the COVID-19 pandemic highlighted disparities in health care access in low-income countries. Many nations in Africa, Asia, and Latin America struggle to secure vaccine, medical supplies, and sufficient healthcare workers to manage the crisis, exacerbating existing health inequalities. Okay, on to the next point. Now, to ensure that there is no inequality, what should we do? What should the government do? There is something that is called universal health coverage. So what is universal health coverage? Universal health coverage is the principle that all people should have access to essential health services without suffering financial hardship. That is why it is called universal. For example, in many countries, even in Kenya, for example, there is what is known as the universal health coverage. So the government is providing health facilities for people. So you just have to pay, like every month, you have to pay like $5, but you'll be given a card by the government. So if you go to any hospital, for example, if you go for dialysis in any hospital, if the dialysis is $200 and you have the card, then you might end up paying maybe half, $100, or maybe less, $50. So universal health coverage is a system that at least allows people to get the health care. So the universal healthcare aims to ensure that everyone in a country, regardless of their income, regardless of your geographic location, where you are coming from or where you are living, or your social status, rich or poor, can receive necessary healthcare services, including prevention, treatment, and rehabilitation. So we are being given an example in Thailand. They have a universal health coverage system which provides free or low-cost healthcare to all citizens. In Cuba, it's known for its robust universal health coverage system which provides free healthcare to all citizens. And even many countries in Middle East, for example, if you go to Qatar, people don't pay for the healthcare services, you know. If you go to Bahrain, you go to Oman, all those countries, they have universal. So the government is the one that is paying for the health services. Now, global health policies and programs, what are they? Global health policies and programs are designed to address health issues that transcend national borders involving international collaboration and action. Global health policies and programs, these are what? Policies and programs designed to address health issues that transcend national borders. For example, if there is an issue in country A, B, or C, there need to be some laws, there needs to be some regulations that will help us to go to that country to help them. ila ghairi dhalik. So these policies aim to improve global health outcomes, reduce health inequities, and ensure access to healthcare worldwide. So here there are some health initiatives by international organizations. Already we've talked before about the role of the WHO. It's a leading international organization responsible for coordinating global health efforts. They have had a lot of effort. For example, the Global Malaria Program, which works to reduce malaria transmission and mortality globally. The UNICEF also, which focuses on the health and well-being of children worldwide. And they have a lot of immunization program in the world, okay, focusing in reducing vaccine preventable disease like polio and measles. And also, we have what? The global health policies often have significant economic implication, both in terms of cost and economic benefits. So here we are being given an example of the Global Fund to fight AIDS, TB, and malaria. This is not very important. Then we have the International Health Regulation. The International Health Regulation and their effects on economics. So the International Health Regulation are a set of legally binding rules adopted by the World Health Assembly to ensure global health security. They require countries to report certain diseases outbreak. For example, if there is an outbreak in Somaliland, they need to do what? To communicate to the WHO. And the WHO will ensure that this disease does not spread outside Somaliland. It just stays inside. So Somaliland has the responsibility to always communicate with its neighbors if there is an intervention or so they require countries to report certain diseases outbreak and public health emergencies to the WHO and cooperate in preventing the spread of disease across borders. So there need to be communication. If the communication, for example, during the time of the Ebola in West Africa, it really affected their economy because people are not traveling to those countries. There was no movement. Even during the time of COVID-19, there was a lot of lockdown, travel restrictions. Many people, schools, they lost their income. Businesses, the aeroplanes, they lost their income. So we need to always ensure that there are some health regulations that cannot impact negatively on our economy. Now, the global health financing mechanism. Global health financing mechanism are strategies and structures that provide the necessary financial resources to support global health initiatives and ensure access to healthcare, particularly in low and middle income countries. So these mechanisms involve a mix of funding from government. So sometimes government can fund, international organization can fund, private sector can also help the government, and other innovative financing model. Now, what is the role of international aid, international support? International aid plays a crucial role in financing health programs in low-income countries, where local resources are often insufficient to meet health needs. So, the international aid, the WHO, the United Nations, the Red Cross, all these international organizations, they normally help African countries because they don't have enough resources. Then public-private partnership in global health. Sometimes the government has to work with the private companies or organization. They need to collaborate to ensure that they address the global health challenges. And There are many examples, but I need you to also think about the examples in your localities. For example, in Somaliland, sometimes you find that the private sector, maybe the Habshil, they can cooperate with the government. They can give the government some fund, ila ghairi dhalik. Telesom, sometimes they can give fund to the. So there need to be collaboration between the public and private. Innovative financing for health. So when you're talking about innovative financing mechanism, they use non-traditional method to raise funds for global health initiative. These models often involve collaboration between public, private, and philanthropic sectors to mobilize capital and improve healthcare outcomes. So when you're talking about the innovative financing, these are the non-traditional methods. These are known as tabarruat. Maybe somebody comes from Qatar and they decide they're going to build a hospital, they're going to give money. So you can find people are just volunteering. They volunteer to help. This is what is known as the non-traditional method. So that's the end of the lesson. Is there any question as I take the attendance? So for those students who are always absent, yesterday I told you you're going to write a research. You'll have to write a research of 10 to 15 pages. You have to choose one of those areas. So you'll go to the course outline. We have from module 2 to module 7. Choose one topic and you'll have to write a research. So the research you have, like the research will be submitted before the exam. So you have 2 weeks to write the whole. You have 2 weeks to write the research. So just choose one topic from the modules and write a research of 10 to 15 pages. So, and it will be 15 marks. Is there any question? So, if there is no question, then we will meet next week, inshallah.